Alright, good morning. My name is Muhammad Jamjum Sarip, a second-year medicine student of Southwestern University, FINMA. Could you please state your name and your birthday, please, for me?
My name is Muhammad Hawi G. Sarif. My birth date is September 28, 2006.
Alright, so I guess your mother have already told you that this physical examination would include some parts of your abdomen, specifically some organs such as your liver, kidney, your bladder, and then your appendix. Would that be okay with you?
Yes.
So do you agree on participating on this physical examination?
Yes.
Alright, so do you have any questions
No.
before starting this? So I'm going with my wash hand. Could you please, for the examination purposes, could you please remove your top, please, and then lie at your back comfortably in this examination bed so that we can start. Please feel free to tell me if you feel any discomfort with this examination. Alright, so first, of course, inspection. In conducting the abdomen, it is quite different from other organs or systems since it follows a sequence different to the other. After inspection, instead of palpation and percussion ahead, auscultation comes first. Why? Since we are avoiding the alteration of the vowel sounds that could give us a false finding. But before anything else, of course, I would be inspecting for your skin color, and then for the contours, for the movements, and then specifically for the shape of your abdomen, and then also for any deviations or deformities, any inflammations, and then also for any masses, and then all in all for abnormalities. So that will be possible with the use of my tangential lighting. So I can also see any distended veins or distensions. But in this case, it is quite normal since the color is very distributed, no masses at all, no bruises, no scarring, and then no inflammations. So with that, I will now proceed with the auscultation. As I've said, auscultation first before anything else in order to preserve the vowel sounds to have it intact. So I would be listening with your four quadrants in here, the right upper, right lower, and then the left upper, and then the left lower. So with the use of my stethoscope, specifically its diaphragm, I would be listening for the vowel sounds. Okay. And as expected, borborygmi is loaded. And that can be counted 5 to 34 per minute. In a full minute, 5 to 34 clicks per minute. And then also for the bruits in each of the abdomen, I will also be listening for your arteries. So aside from the four quadrants, I will be also be using the diaphragm in order to listen for any bruits onto your abdominal arteries. So actually, we also have four. So you're at your sternum, edge of your sternum, below. Located is the aortic artery, which I will be listening. And then beside are the renal arteries. And then beside the umbilicus are the iliac arteries. And then near the suprapubic is the femoral arteries. So I'm listening for any bruits or somewhat like murmur-like. So in your case, that's normal already. Now after auscultation, I can now be proceeding to percussion and then palpation. So in percussion, I will be conducting a pressure. I'll be applying a pressure basically on the four quadrants. So with the use again of my middle finger and then another middle finger of the dominant and then the non-dominant hand. So I will be listening basically for any dullness and then tympani. I can also be exploring bending on the areas per quadrant. So it depends. So usually tympani would indicate air field and then dullness would indicate organ field or fluid field. So with the presentation of the quadrants respectively with the organs located, dullness and tympani can differ. So now we'll now be proceeding to the final stage of the examination, which is the palpation. So first I will be using light palpation. So with the use of my finger pads, lightly palpate by quadrant. So let me start with the left upper quadrant. So please tell me if this hurts.
No.
About this one,
No.
is this painful?
No.
No pain. So I'm looking for any tenderness. Okay, is this painful?
No.
Is this painful?
No.
Okay, so now I will now be proceeding to the deep palpation. So in the deep palpation, what I'm trying to rule out is for any abdominal masses. So with the use of my non-dominant hand, being pressed by my dominant hand, all with the use of a finger pads, I will be compressing for any masses. So please tell me if this hurts. Does this hurt?
No.
No at all. How about this?
No.
How about this?
No.
How about this?
No.
Alright, so that's it for the palpation. But now I will be proceeding to the most vital abdominal organs, which includes the liver, the kidney, and then the bladder, as well as the appendix. So for the liver, I will have to palpate you back through and through, back and then front. So at the back, at the line of the 11 to 12 ribs, 12 ribs. So usually, since the liver is covered mostly by the rib cage, so it is in line with the 11 to 12 rib. So please relax on my hand. Relax on my hand. You can rest at my hand, okay? Rest at my hand while my other arm at front would be reaching for the lateral to the rectus muscle. So to the rectus muscle. So upper quadrant. I can now feel the edges of the liver. Does this hurt?
No.
None at all. So there is no swelling or inflammation. Now, another examination for the liver is the hooking technique. For the hooking technique, I will be reaching also to your coastal margin. So the coastal margin would lead me from the dullness indicated along the mid-clavicular or the mid-nipple. So as long as I've reached the dullness, there I will then be, it's like quite a hook, feeling the edge or the bottom of the liver. Does this hurt?
No.
Okay, very good. So by assessment, normally the liver must not be swollen or not enlarged, and then that's normal. So finally, no, not that final. I will now be proceeding to your kidney. So for your kidney, could you please sit for me? Sit first. Now, and then face here. And then could you please wrap this while exposing this to the camera. So since the kidney is retroperitoneal and it is in upper quadrant, I will be palpating it. However, I will be percussing it. However, in the percussing, it's somewhat like combination of palpation and percussion, since I'm using a palpation on my non-dominant, and I will be percussing it with my dominant hand with the use of a fist or at least the ball of the ulnar. But with a quick blow, please tell me if this hurts.
No.
Again, or in some cases with a quick blow, full blow fist. So again, does this hurt?
No.
Okay. So now, second to the last is the bladder. Could you please lie again? Lie down for me. Now for the bladder again, I will be percussing for any dullness and then palpating in order to feel the smoothness of the dome. So normally it is smooth. So of course our bladder would be here. So I will be percussing it, and then does this hurt?
No.
400 to 600 ml actually is the capacity of our urinary bladder. Now please tell me. No, you need not to tell me. I just got to hear it for the dullness. Since it is usually the urinary bladder is filled with urine, of course it's fluid, so it is dull in nature. Now for the appendix, since it is located at the right lower quadrant, I can already suspect for possible appendicitis by just palpating and then looking at your face for any facial grimace, any pain, reported pain, as much as possible, or even guarding. So at this point, no. So it is okay. So for the McBurney's point, it is one of the gold standard for identifying appendicitis, since the McBurney's point lies 2 inches from the anterior superior spinous process of the ilium and then the umbilicus. So by just the same palpation, I will already be looking and then observing you with any facial grimace and then guarding again. But in this case, none. Alright, so thank you very much. Could you please sit now and then put on your shirt? And then, do you have any questions after this?
No.
Alright, so that would be all, and then thank you very much. Hoping to see you again.